It was a pleasure to be here to hear these really stimulating talks. And we're very appreciative that inflammatory bowel diseases was included as an example of a complex chronic disease, and welcome the opportunity to, I only need to know how to, this one, the green, okay, great. To have the opportunity to support this workshop because nutrition and diet is really, really important to our patients. And we need to find ways to actually be able to think about how to support our patients with inflammatory bowel disease in these areas. And when we think about it, we sort of break it out into two areas. Diet as therapy and diet to maintain nutritional health. And yet, even in both of them, there are challenges. So diet as therapy, it was clear from Gary Wu's discussion and early discussions that we need more science to support interventions there. But even when we think of diet to maintain nutritional health, there are the challenges of the regulatory pathway and reimbursement hurdles to enable access for our patients to access enteral and nutritional products. Because I was thinking, those products may be there, but if our patients cannot afford them because there isn't the appropriate regulatory pathway and insurance reimbursement, there's a huge gap. So as I said, for our patients, we know that our patients are at risk for malnutrition. The Crohn's and Colitis Foundation supports a quality improvement effort, and as part of that, we screened around 2,400 patients using a well-validated screening tool and found that 28% were at medium to high risk for malnourishment. So there is a great need to be addressed in the IBD community. And patients and providers are seeking alternative treatments. And I guess I wasn't supposed to say medical foods. And I think that also brings up the fact for a need for consistency in terminology. So that terminology that's used by the researchers and is used by FDA and by insurance companies has to also be used by patients and providers. So we're all aligned in terminology so that we can get the right products to the patients and have them covered by insurance. So we are working with other groups like NASPGHAN, which is a pediatric GI professional organization, and the American Gastrological Association, to engage on legislative asks to improve access. But we know that we need a clearer definition of what we are talking about, whether it's medical foods or nutritional or nutrients, and a simpler way to get regulatory improvement and reimbursement strategies. One of the speakers mentioned, well, in 20 years, we're going to have this understanding, but our patients, we don't want to wait 20 years. Our patients are suffering. They have a need now. So questions that we think need to be addressed are how can the science guide the FDA in defining whatever we call these products to allow for more streamlined regulatory approval? How can the science impact reimbursement decisions? As we talked about, is there a need for randomized controlled trials, other more real-world evidence-based studies that could be done that will inform regulatory decisions and reimbursement decisions? And what research studies can we at the foundation be engaged in to further the understanding of special nutritional requirements in ABD to facilitate all of this? Thank you.